We've all been there. That dreaded feeling of nausea creeping in as you start your day. Your stomach churns, you feel a little queasy, and suddenly, breakfast doesn't seem so appealing. But what exactly causes that morning nausea? Morning nausea, while often harmless and temporary, can be a sign from your body that something is slightly off. In this exploration of morning nausea, we'll delve into the common culprits behind this morning misery. So, buckle up as we embark on a journey to understand why your stomach might be saying no to mornings, and, more importantly, what you can do to win back your mornings and start your day feeling your best. When it comes to morning nausea, there are a few usual suspects that often take the blame. These common culprits can range from hormonal shifts to digestive distress, each leaving you with that less than ideal queasy feeling. One of the most frequent offenders, especially in women, is pregnancy. The surge in hormones, particularly human chorionic gonadotropin, or HCG, can wreak havoc on a woman's digestive system, leading to the infamous morning sickness. Digestive issues like gastroesophageal reflux disease, known as GERD, gastritis, and irritable bowel syndrome, or IBS, can all make their presence known in the morning with a wave of nausea. These conditions often involve inflammation or irritation in the digestive tract, making it difficult for your stomach to do its job comfortably. And don't underestimate the power of dehydration. After a night of sleep, your body is naturally a bit dehydrated. Understanding these common culprits is the first step in finding relief from morning nausea. Pregnancy is an incredible journey filled with anticipation, joy, and, unfortunately for many women, morning sickness. This common pregnancy symptom, often characterized by nausea and vomiting, is primarily attributed to the surge in hormones, especially HCG, that flood a woman's body during the first trimester. While it's often referred to as morning sickness, the truth is that this pregnancy-related nausea can strike at any time of day or night. The good news is that morning sickness typically subsides as pregnancy progresses, usually around the beginning of the second trimester. If you're struggling with morning sickness, there are several things you can do to find relief. Eating small, frequent meals, avoiding trigger foods, and staying hydrated are just a few strategies that can help ease nausea and make those 9 months a little more bearable. Sometimes, the root of morning nausea lies within the intricate workings of your digestive system. Conditions that affect the stomach, esophagus, or intestines can all contribute to that queasy feeling upon waking. One common culprit is gastroesophageal reflux disease, or GERD. This condition occurs when stomach acid flows back up into the esophagus, causing heartburn, indigestion, and often nausea. The discomfort of GERD can be particularly pronounced in the morning, especially if you've eaten a large meal or consumed trigger foods like spicy or fatty meals before bed. Another potential troublemaker is gastritis, which involves inflammation of the stomach lining. This inflammation can be caused by a variety of factors, including bacteria, excessive alcohol consumption, and certain medications. When gastritis flares up, it can lead to nausea, vomiting, and abdominal pain. Irritable bowel syndrome, or IBS, is another digestive disorder that can manifest as morning nausea. If you suspect your morning nausea is stemming from a digestive issue, it's essential to consult with a healthcare professional for proper diagnosis and treatment. Believe it or not, something as simple as dehydration can be the culprit behind your morning nausea. When you wake up in the morning, your body is naturally in a state of mild dehydration after a night of sleep without any fluid intake. This dehydration can disrupt the delicate balance of electrolytes in your body, particularly sodium and potassium, which are essential for proper nerve and muscle function. When these electrolytes are out of whack, it can trigger feelings of nausea. Moreover, dehydration can also slow down digestion. Simply rehydrating your body by drinking plenty of fluids, especially water or electrolyte-rich beverages, can often alleviate those nauseous sensations and get your day back on track. The good news is that dehydration-induced nausea is usually easy to remedy. While pregnancy, digestive issues, and dehydration are among the most common culprits behind morning nausea, they are not the only possibilities. A range of other factors can also contribute to that queasy feeling upon waking, from medication side effects to underlying medical conditions. Certain medications, particularly those used to treat pain, infection, or high blood pressure, can list nausea as a common side effect. If you've recently started a new medication and notice an increase in morning nausea, it's essential to speak with your doctor. In some cases, morning nausea can be a sign of an underlying medical condition, such as migraines, inner ear problems, or even certain types of cancer. Stress and anxiety can also take a toll on your digestive system and trigger nausea. When you're stressed, your body releases hormones like cortisol and adrenaline, which can interfere with digestion and increase stomach acid production, leading to that familiar uneasy feeling. Medications, while often essential for treating illnesses, can sometimes come with unwelcome side effects, and nausea is a common offender. Certain medications can irritate the stomach lining, disrupt the balance of gut bacteria, or even interfere with the way your brain perceives signals from your digestive system, all of which can lead to feelings of nausea, especially in the morning. Pain relievers, a staple in many medicine cabinets, are often associated with nausea as a side effect. Non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen and naproxen, while effective at reducing pain and inflammation, can irritate the stomach lining, leading to discomfort and nausea. Antibiotics, another class of medications commonly linked to nausea, can disrupt the delicate balance of bacteria in your gut. If you suspect your morning nausea is a side effect of your medication, it's crucial to talk to your doctor. They can help determine if adjusting your dosage, switching to a different medication, or taking the medication with food might alleviate your symptoms. The mind-body connection is a powerful force, and nowhere is this more evident than in the gut. Stress, anxiety, and other emotional stressors can wreak havoc on your digestive system, leading to a range of uncomfortable symptoms, including nausea. When you experience stress, your body kicks into fight or flight mode, releasing a surge of hormones like cortisol and adrenaline. While these hormones are designed to help you cope with perceived threats, they can also interfere with normal digestive processes. Cortisol, for example, can increase stomach acid production, which can irritate the stomach lining and contribute to nausea, especially if you're prone to conditions like GERD or gastritis. Adrenaline, on the other hand, can slow down digestion by diverting blood flow away from the digestive tract and towards the muscles and heart. Learning to manage stress through techniques like deep breathing exercises, meditation, or yoga can not only benefit your overall well-being, but also help keep your digestive system happy and nausea at bay. Waking up to a wave of nausea can throw a wrench into your entire day. Combat morning queasiness with these tips and tricks. Start your day with a gentle approach to eating. Stay hydrated to prevent dehydration-induced nausea. Ginger can be your best friend when queasy feelings strike. Consult a healthcare professional if nausea persists.